It's little worse than when your child is in pain. And like all of us, it's a lot worse when they're tired and irritable. So this is the sequence of teeth coming through. They start at 6 months, and by the age of 3, they've normally got 20 teeth. And during this period, generally you have the problems, we term it teething. And at the age of 6, the front teeth wobble out and they get some new teeth at the back. And these can be a little bit uncomfortable. For babies, you can use like the Demi or a Soother. As they get older, you might be able to use a gel. Be careful applying it. And of course, there's always Calpol. Around the age of 9, the baby molar teeth start to wobble out and you get the new premolar teeth. And then by 12, you get the second molar teeth at the back. Hardly anyone has soft teeth. It's basically they decay if the diet's poor, the toothbrushing is poor. So look elsewhere in the app for this. But if you get an abscess, then they're painful. And sometimes you need antibiotics, and sometimes you need to have the tooth out. Sometimes it's just food packing, and so if it's in between the teeth, then it just needs to be cleaned out. It might take a few days to settle down, but because the tooth will have moved, and it'll just be tender because of that. And again, it might be just about to fall out. There are instructions for putting a temporary filling in the adult section. That's not always required. And regarding the swelling again, swelling here at the age of 6 is far more serious than the age of 9 when the tooth's about to fall out. And you can always email a picture of your child's problem to the dentist for some reassurance and advice. And take some analgesics, get some advice from the pharmacy. And occasionally they may not have a problem, they may be, I think the term's called attention seeking, and they might just want a little bit of attention. However, if they've got an external swelling or a large swelling inside the mouth, then it's likely they'll need some antibiotics. Not all swellings require treatment, and they can tend to come and go without a lot of discomfort. And clearly, while this isn't ideal, it's very unusual for them to affect the developing tooth underneath. And there is a risk element regarding a general anaesthetic, because very few children like having teeth taken out, and the process can just traumatise them for life. So if you can see a yellow tinge to the swelling, it may be possible for it to discharge if you put a bit of magic cream on the gum and encourage them to rub their cheek from the outside. Clearly, if the oral hygiene improves and the diet improves, then in the teenage years they should have no problems, and this is often the case. It's their responsibility, but it's your responsibility to encourage them to develop these good habits from a very early age. Get them to download the app. They may stop listening to you, but they do like looking at their phone.